Since late last year, Texas hospitals have been asking patients if they are U.S. citizens. It's an executive order from Governor Greg Abbott. He says to learn the cost of care for undocumented patients. And early data just released reveals a 1-month snapshot from November, when the state said there were at least 30,000 undocumented patient visits recorded statewide, costing nearly $119 million, with some hospitals yet to report. As the data collection continues, investigator Arzo Dost learned who's worried about long-term health impacts.
For months, we've called and emailed dozens of clinics and hospitals in Central Texas asking about health impacts if immigrants living here are wary of going to their doctor or the ER, and what guidance has been provided if ICE agents show up. There was a common theme: silence and hesitation to speak or attract attention, except from a few like the Louis D. Atabey Midwifery Project, or LAMP, the Community Reproductive Health Clinic, created to meet the needs of people of color, tells me since hospitals started asking the citizenship question, many clients are delaying care or even avoiding emergency treatment.
People are fearful.
It doesn't surprise the Texas Civil Rights Project, which has been educating people about their rights, following Governor Greg Abbott's executive order.
Work to put out resources to let people know in the community that they have a right to decline to answer this question about their citizenship status.
We're trying to gather information, so first we can determine the magnitude of the challenge that we face.
Hospitals must tell patients their response will not impact receiving quality care, and personal information will not be reported. Still, it's even caught some citizens off guard.
Are you a U.S. citizen or lawful in the United States? Yes, no, or no response.
Shannon Jamrock says she was surprised to see the question at Dell Children's Medical Center in North Austin. She'd rushed her son to the ER in March after he fell off his bike and hurt his wrist.
It was asked right away before we could sign any other documents to get him seen. I just feel it's uncalled for. I don't understand the point of it. I don't understand why any child needs to have that answer to receive care.
What was your response?
I clicked no response. You know, you seek emergency care for your child and have them have their citizenship questioned when they walk in the door. It takes you back. Why does that matter? Who are you going to tell?
We asked Dell Children's repeatedly about the question and the data the hospital is collecting, but they directed us to the Texas Hospital Association. In a statement, THA told us, in part, hospitals are required by law to treat anyone who comes through the door, regardless of ability to pay, regardless of their demographics. The fact that hospitals are required to collect this data should not be a deterrent for people in need of care.
Quorum's present.
During a recent hearing at the Capitol, THA told state lawmakers it had concerns with proposed related legislation.
We would like the legislation to affirmatively state that we are not required to verify patients' answers, and then due to the threat of potential security concerns among hospitals that treat a high number of undocumented persons, we would respectfully request that individual hospitals' reports be exempt from public information disclosure so they will not be targeted.
Lawmakers this session have considered solidifying the required question and the rules surrounding it beyond the governor's order and into state law.
It's a simple question that's being asked, and their care is not being affected.
If you choose not to tell your immigration status, then people know you didn't tell it, and then they think maybe you're hiding it. So like for me, if I went to the doctor, I wouldn't fill it out because ain't nobody's business. I need for the doctor to pay attention to my health, not whether I'm a U.S. citizen.
The hospitals are not reporting any individual information to us.
You know, there's no positive duty to disclose that information to ICE, but neither is there any guarantee that it couldn't happen.
Florida has required the question by law since 2023. Last year, it reported less than 1% of hospital and emergency room patients who answered its question were undocumented, out of more than 12.4 million total patients statewide. Throughout all of 2024, hospitals provided nearly $660 million in healthcare services to those undocumented patients, out of nearly $87 billion spent on all patients.
It is such a small percentage.
State Representative Solomon Lalani, a doctor in the Houston area, has been watching the data and in an op-ed after Texas's order shared concerns.
Texans are not coming forward, so out of fear, they're not taking care of their illnesses, they're not managing their chronic problems, and it is becoming an emergency overall.
What does this mean for health outcomes in Texas?
People are not taking care of managing their diabetes or heart failure or blood pressure medicines. But then, on top of it, the psychic, somatic illnesses that comes forward, depression, anxiety, that is playing a bigger role.
So listen, the concerns about that are completely unwarranted.
Governor Abbott blames what he calls the Biden administration's open border policies and recently told us he's demanding Texas taxpayers be reimbursed.
I think there would be every reason why the state of Texas would have the right to sue the United States government because it is the United States government's responsibility to pay for any of the costs concerning illegal immigration, and Texas healthcare facilities should not bear that burden.
The Texas Health and Human Services Commission, which collects the data under the governor's order, wouldn't agree to an on-camera interview with us, but said future reports will include full quarterly data, with an annual report out in January 2026. Arzo Dost, KXAN Investigates.
The citizenship question also puts a focus on the state's uninsured. Texas 2036, a nonpartisan public policy organization, says looking at available data of around 5 million uninsured Texans, an estimated 15% are undocumented. The think tank says the majority of the state's uninsured are here legally, which has a bigger cost impact for hospitals. More about that in this story online now.